Rural hospitals are community strongholds, serving as the key point of care for nearly 20% of Americans. Beyond providing healing and hope, rural hospitals nationwide are pillars of their local economies, creating essential jobs that support families and community vitality. The emergence of COVID-19 has created unprecedented challenges for the U.S. hospital system. As frontline responders, hospitals have significant responsibilities for identifying and treating patients with COVID-19. Hospitals around the country are adapting to the constantly changing face of the COVID-19 pandemic by adopting both expected and novel strategies to tackle the crisis. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hederle, senior writer for AHA. AHA has tracked the stories of several community hospitals as part of our coverage of COVID-19. These stories and their podcasts may be found on aha.org. As part of this series, we share how rural hospitals have found new ways of delivering care to patients under COVID-19. Today we hear from Brian Evans, CEO of Clark County Hospital in Osceola, Iowa, who applied for and received funds to expand telehealth services to include home monitoring. In addition, we're joined from Des Moines by Corey Martin, Senior Director at the Iowa Hospital Association, who manages the Iowa Rural Health Telecommunications Program. Welcome, Brian and Corey. And over to you, John.
Good day. I'm John Supplett, Senior Director of Rural Health Services for the American Hospital Association. With me today is Brian Evans, CEO of Clark County Hospital in Osceola, located in the heart of the farms and pastures in south central Iowa, about 60 minutes from Des Moines. Also joining us from Des Moines is Corey Martin, Senior Director at the Iowa Hospital Association, who manages the Iowa Rural Health Telecommunications Program. Very recently, Brian and his team at Clark County Hospital applied for and received funds from the Federal Communications Commission to build on his telehealth platform to include home monitoring under COVID-19. On this podcast, we'll learn how they did it, why they did it, how it's working, and what it means for next steps in treating patients remotely. Brian, I know you're still managing cases and treating patients under COVID-19, and there's much our rural hospital colleagues can learn from your experience, particularly telehealth. Thanks for taking the time to share your story with us.
You're welcome, John. I appreciate the opportunity to share our story, and I hope others benefit from our experience.
Brian, I understand that on March 2nd, you activated an incident command task force comprised of yourself, the city of Osceola, county school districts, law enforcement, and Clark County agencies for emergency management and public health, among others. Where do you stand now in your efforts to manage the COVID-19 crisis?
Presently, Clark County has experienced 85 cases, of which 15 are active. Since June 1st, when we had 31 active cases, those numbers have continually declined to the present level of 15 active cases. We've had 68 that have recovered, and there have been 2 fatalities. We continue to work with the city, county, and state on the orders of the public health disaster emergency regarding testing, elective surgeries, the availability and use of PPEs, and management of our disaster plan for a medical surge. Since the beginning of June, we've been participating in drive-through COVID-19 testing. The public health, Clark County Hospital, and emergency management all collaborated and developed a testing site at the Clark County Fairgrounds. The first week of June, we did testing, and we did 54 patients through the drive-through screening. It brought in people participating in doing the testing, registration from all different areas from the hospital, public health, surrounding communities such as Decatur County. We continued that earlier this week, where we did an additional screening site, again at the fairgrounds, and tested 86 patients.
So tell us about that. How have you integrated your telehealth platform into managing people who test positive for COVID-19?
Telehealth isn't new to Clark County Hospital. We've been at the forefront of using broadband technologies for years and use it to provide patients with access to specialists. By means of the blanket waiver from CMS under the National Public Health Emergency, we've been able to expand our services and treat patients remotely when they were reluctant to visit the hospital or the clinic. Specifically, we were able to complete home-to-office video visits. Our providers also did regular calls with many of their chronic patients.
So how have you expanded this service, Brian, and has utilization of telehealth changed since the COVID-19 crisis?
Many of our residents, especially seniors, are reluctant to travel to the hospital or clinic in fear of being exposed to COVID-19. Yet they've got chronic illnesses and need the care. To address that, we have expanded our telehealth visits from the patient's home to the clinic. This is an option that we first started on March 30th, and we'll continue to offer it as long as the service is needed or as long as the waivers are available for us. As a result, we've seen a significant increase in the use of telehealth visits. Not all visits have been video due to a gap in broadband within our county. Our physicians and advanced practitioners were also calling patients at home to check on them.
So tell us then, Brian, how does this service work at Clark County Hospital?
For video, we work off the Cisco WebEx meeting platform, and patients download the application to their computer or mobile device. This requires a reliable internet connection, which can be a challenge where there's a gap in broadband. For those with internet, the patients call to the clinic to schedule an appointment, and we send them an email to confirm the telehealth visit. Within the email, there's a link, and the patient clicks the link to the email at the appointment time, and they connect first to the nurse. The nurse does the workup of the patient, and then the provider joins the call.
Tell us about that. What are you doing differently now than perhaps 3 months ago?
Because of the need to shelter in place and maintain social distancing, and with the financial support of the FCC program, we're expanding to home monitoring. This allows our care coordination team to monitor patients with COVID-19 and to track patients who have tested positive and treat them if the need arises. We know that patients' conditions can change with COVID-19, and we want to be able to quickly assess them should their condition change. As COVID-19 continues to grow as a public health concern, we think home monitoring will help keep our community and staff safe by avoiding unnecessary in-person encounters.
And how were you able to expand home monitoring?
Under the CARES Act, the Federal Communication Commission created a $200 million COVID-19 telehealth grant. It was open in April, and we were among the first to apply for assistance. It's not a grant program, rather the FCC reimburses us for approved expenses. We received approval for $170,000 and are using the funds for tablets, network upgrades, and remote monitoring equipment to use home-based access, as well as to provide telehealth video units to patients and exam rooms. This helps minimize the provider-patient contact, and it preserves resources such as PPEs. We plan to use the home monitoring system to track COVID-19 patients who have tested positive and are symptomatic. We can also use the equipment to monitor COVID-19 patients who have been discharged to ensure a full and safe recovery. The equipment also helps us monitor patients with chronic diseases during the crisis and will continue once the crisis ends. The FCC award is for immediate use, but it also helps us in the long term. It is a catalyst to develop new and improve existing services and quality. That's why we try to improve the quality of care to the community.
All right, how does Brian's experience at Clark County Hospital intersect with your administration of the Iowa Rural Health Telecommunications Program?
Brian and the team at Clark and Unity Point have done great work on theirs. And although Brian and I are part of separate telehealth networks, the work we're doing is really similar. The purpose of the Iowa Rural Health Telecommunications Program, IRHTP as we know it here, is to connect 85 hospitals in Iowa and 2 additional ones in South Dakota to a dedicated broadband fiber network using the Iowa Communications Network infrastructure. We've been active at it for 10 years now when we were first approved by the FCC to provide that last mile fiber connections for our members. And the advantage of this network is that we can apply for funds as a consortium across the state. And that's because we've done the work to build, USAC HCP numbers, to register sites and get them all set up. And now, IHA as the management team for that can participate in the FCC and the USAC programs for reimbursements.
That's great, Corey. So was that the case on this occasion?
Yeah. Through our Iowa network, and through those hospitals, we did assist many of our rural hospitals in their applications for the FCC COVID telehealth program funds. And so far, that's proving to be a huge success for them. And in addition, having that expertise, we were able to collaborate with a number of hospitals and apply for a USDA Rural Development Distance Learning and Telemedicine Grant Program. And this program helps rural communities acquire technology and training necessary to connect the medical professionals and providers who serve rural residents at the local level. Excitingly, we had 8 hospitals that submitted info to our joint application and to our funding, and we're just anxiously awaiting the results.
Well, thank you, Corey, and I have every confidence that your application will be successful. For those who are interested in pursuing funding for telehealth and distance learning, the FCC is accepting applications on a rolling basis until its funds are gone, while the USDA deadline for applications under the Distance Learning Telemedicine Program is July 13th. The strength of our rural healthcare is critical to the fabric of American healthcare, and it's our mission to safeguard it, improve it, expand it, and advance it for future generations. Thank you for our country's healthcare providers for their hard work, dedication, and sacrifice in this trying time. Specifically, hospital and health systems leaders like Brian Evans, CEO, and his team at Clark County Hospital in Osceola, Iowa, and to Corey Martin from the Iowa Hospital Association for coordinating their efforts as part of the Iowa Rural Health Telecommunications Program. This is one of several stories of how rural hospitals are rising to the challenge of COVID-19. Visit www.aha.org to access these and other COVID-19 resources available to hospitals and health systems.